Hi, my name is Dr. Lev Kandov, and today I'd like to present a case to you regarding one of my patients that I've been seeing for a while, but he hasn't been ready for treatment until recently. He's a 45-year-old male that's medically very healthy. He's getting married in August, and that was the motivating push for him to get all his dental work done. His main concern is fixing up his back teeth, because as you'll see, he's missing a lot of crowns. He's got some missing spaces, and his front teeth he wants bleached and get them whiter. So these were the x-rays taken during the recall exam, and you can see that a lot of the back teeth are missing permanent crowns. You can see it both on the left and right side. He has a previous infection that was on tooth number 13, but this infection has been here for the past 3 years, so I believe it's scar tissue. So we're not going to go in and retreat this previously done root canal. What else you can see from this x-ray is that tooth number 4 is very short and very hard to restore without doing a root canal and a prior to that. You can appreciate the rotation of his teeth in the front, the fact that he's either missing temporary crowns or permanent crowns on his back teeth, and the missing spaces that he has. These are the bottom teeth. Another one of the patient's concerns was that he wanted the metal fillings, the amalgams, taken out, and he wanted the white fillings placed in. So we definitely did that for him. These are the side views when the patient is biting down. Again, you could appreciate how tooth number 4 is completely broken down to the gum line. So this is why we're going to have to do the root canal to build it up. His other teeth either have cavities and they've erupted down to a point where they're actually touching the opposing teeth. And there we go, this is the root canal that I was telling you about that we did for him. And the patient was comfortable, it was done on one visit, and he had no complaints afterwards. We were able to build up the teeth and then shape them for crowns. And the crowns that we did for the patient were done all in one visit using CEREC technology. All the crowns were porcelain and very aesthetic. These are the teeth that were shaped on the other side. This was done at another time. So we did the left side and the right side for the patient. We sent him over to the oral surgeon to get the implants placed in the edentulous spaces. These x-rays were taken after I did the crowns and the teeth, and after we placed the abutment into the implant. These are the final restorations. On the right side, you can see that from the x-ray that the margins are very well adapted to the teeth. There's no excess cement, and it's a very aesthetic result. Now the beauty about doing these crowns in-house with the CEREC technology, it allows us to create the context that we want, the bite that we want, so that we maintain the patient's occlusion properly without affecting anything else. So once all those restorations were done, the patient finally decided to bleach his teeth, so we gave him an at-home whitening kit. And this is after a couple of weeks of bleaching, and then he had a couple of more weeks of recovery. So this was the final result that he got. I pointed out to the patient that the two front teeth had a lot of wear, so I asked him if he wanted to build up the teeth so they're a little more straight. And he agreed, so we did that with some composites. Relatively short appointment. He was really excited about the results, and he's excited to take his wedding pictures now. I want to thank you for listening, and have a good day.